This government meeting is brought to you by Eastworks and our local cable subscribers.
So just want to make a call for a motion to open the meeting for Easthampton Board of Health, March 15th, 5:03 p.m.
I'll make a motion to start the meeting on March 15th, 2022 at 5:03 p.m. The Board of Health.
Second that.
All in favor? Yes.
Amy, aye.
Beth, yes.
Do you want to do a quick roll call first, Jackie?
Yep,
Just
that's fine. Maggie Hebert, board
Here.
chair.
here.
Amy Petrosky, board member. Beth Rist, board member.
Here.
Okay, just a couple of housekeeping things. Just want to say, in accordance with Mass General Law, we're required to let you know the Board of Health is recording this meeting. We will begin with public comment, and during this time, you're limited to 3 minutes for your public comment. Please note the board will be actively listening to your input for future discussion. We will not be responding to any of your comments at the time. If you have questions, please put it in writing and submit for later discussion. There are some ground rules for public speak time. There will be no disruption, booing, heckling, or intimidation of any other speakers or the board. Do not speak unless you are recognized by the chair. All speak time is addressed to the board and not the audience. And I guess we can open for a public comment.
If anyone wants to speak, just raise your hand. I think you under the reaction button. Maggie, do you want me to start? Jean?
Oh, yep. Go ahead, Jean.
All right.
Please state your name and address before you begin speaking.
Oh, okay.
We can hear you.
Okay, so it's just audio, not visual then.
Yep.
Okay. I just wanted to say, okay, my name is Jean Powell-Wilson. Hold on, there's a little comment here. Okay, my name is Jean Powell-Wilson, and I'm a resident of Easthampton for about 20 years. And I just wanted to, I just wanted to acknowledge, thank you for the mask, making it mask optional and being able to hear us. I also wanted to just mention that I know that in the last week or two, there's been a lot of information that has been released regarding the Pfizer documents that the FDA had wanted to hide. And I think that is noteworthy that they wanted to hide it for 75 years regarding the vaccine. And so I think it would be important and imperative to take a look at why, because there's a reason that they wanted to hide it. So I know that you're trying to make the best decision for the community. So I just encourage you to take a look and think more about why they would want to hide the information. On another note, I remembered, maybe it was in the last meeting, the mayor acknowledged a local group that donated the KN95 masks for children. I just wanted to have a question. I know you can't answer it right now, but just to look into more, because I think the CDC, while they approved the N95 masks, they didn't approve the KN95 masks for children. So I was just curious about how that would work going forward, given that it's approved and unapproved. The KN95s are not approved, but then also they're being donated for use, and to see if that is even a good idea for the children. So thank you very much.
Thank you, Jean. Is there anyone else that would like to use public speak time? Just raise your virtual hand if you would like to. Okay. I guess we can move on to the agenda. So I've got too many things open on my screen. Pull it up. Hang on one second.
I think just the only agenda item is to review the FY23.
Yep. Okay, so let's move on to the first item on the agenda, the budget. Did everybody have a chance to review that?
Mhm.
Do you want me to share my screen and go over anything?
Yeah, that might be good. We can do line by line. Oh, I had trouble converting that to an Excel document, couldn't do it.
Let me see. 1 second. I just want to make sure that. Okay. Okay. You guys see it okay?
It's
Is
coming.
the Bree, is the version that we got on
Yep.
February 24th the same version that we have now? The same version you're showing us?
Probably not. I had my budget meeting with the mayor and finance and auditor last week, and there was a couple more like clerical changes, but no numbers changed or anything.
Okay, so we should look at what you're showing us, not what we have in our emails.
Yeah. So this year, the mayor's office asked us to submit a one-page document, one-page narrative, where in the past we kind of had free reign and I would write like a 5-page narrative. And the narrative is actually helpful to me because I take that past calendar year and put it all the numbers, all of our data kind of into one spot. So at first I was happy that we only had to write a page, but then I kind of still wanted to write more. So I ended up doing kind of a 2021 year in review, just because, like I said, it's helpful for me to keep all the data in one place. So I'm not going to go through everything unless you guys want to, but I just wanted to let you know why I have this. And the mayor told me that we can post it on our website. So like I said, it kind of goes over COVID, flu clinics, inspections, public health, nursing, animal inspections, and the Healthy Youth Coalition. So is there any questions on this document?
Is the Healthy Youth Coalition paid for out of operating budget, or is that a grant?
It's a grant, but they fall under the health department. So I like to highlight what they did over the past
But it's
year.
a different funding mechanism. It doesn't need to be appropriated is what I'm saying.
Yeah, so in the next document that I show you, you'll see what is like general fund and what's grant funded.
Thanks.
You're welcome. So that's my year in review. This is the actual budget narrative. That has a spelling error. So we're asked to just limit it to 5 bullet points. So I limited it to the regional clinic in Northampton, how mostly Jackie assisted residents in signing up for appointments. We offered homebound vaccinations, and we held 9 vaccine clinics throughout the city. We created the COVID-19 data dashboard, received and investigated and followed up on a total of over 2,000 communicable diseases, and that includes COVID. Received and managed 163 regular kind of code enforcement complaints, so housing, food, nuisance, which was a 19% increase from 2020. And I just
Bree,
did.
do you know what the increase was from 19 to 20?
I have it. I would have to go into my.
What I'm wondering, so an increase from last year to this year, but was last year depressed because of COVID? Like, did we receive significantly less complaints last year because of the pandemic? So that 19% increase is really just more on par with pre-pandemic numbers.
Yeah, the way that we track our complaints is by category. So I'm able to see we do monthly. So I'm able to see each month what the complaint type is. So I am able to like delete the COVID complaints out. So you would be able to see like actual non-COVID. You can see just COVID complaints from 20 to 21.
I don't mean COVID complaints. I mean, because less people are in restaurants, so they didn't complain about a restaurant. Less people
Yeah.
were leaving their house, so they may not have seen their neighbors' nuisance property.
Right.
Yeah, I think our complaints were definitely suppressed for that. I think a lot of the focus was on COVID, so we tend to see, I would say, our housing decrease. I'd have to look at the numbers a little bit more. I can send you guys the the monthly inspection and complaint tracking, so you can see all the different types of inspections and complaints that we.
I don't need to see the specifics, but if you want to, at the next meeting, if you want to let us know kind of the overall complaint numbers for 2019, 2020,
Yeah.
2021, that way we can see whether
Yep.
that
There
19%,
really is.
if that 19% increase is actually just what it was in 2019, adjusted for COVID.
Right.
Yeah, I have all the total numbers too, so I can definitely look back at the total numbers.
Thank you.
You're welcome.
Good
And then
point, Amy.
and then the Healthy Youth Coalition, they're growing their executive committee and they are working on a safe storage campaign right now. I don't know if you've seen that anywhere on social media, but they are doing some education and some promotion around safe storage of medicines, drugs, and stuff in the household. So they're moving along quite nicely. And oh, I can't get to my other tab. 1 second. Okay, this is just the organizational chart, which is required every year in our budget. So Board of Health, Health Director, then we have our clerk, Health Inspector, Public Health Nurse, our Healthy Youth Coordinator, who then manages the parent and outreach worker and 2 youth workers, our community social worker, which we have not yet hired, and our animal inspector, who's actually paid for from the police department, but they are managed in the health department. And so I will go over salaries after. I kind of just want to highlight right here, which this year we were asked to create a budget with a 1%, 2%, and 3% increase for just our operating budget, not including salaries. Which the 1%, 2%, and 3% doesn't really make a big difference because our budget's, you know, not very large. So the 1 or the 2 and 3% didn't really make a huge difference. So where I added the 2 and 3% is in education and training, because with the public health nurse now and with our health inspector, there's definitely more training than where, you know, 2-3 years ago, it was pretty much just the health director. So I wanted to
And
make
with the performance standards and workforce standards that DPH is expected to announce in the first quarter of this year, that training is going to be required. So having money in there isn't going to hurt you.
yeah.
That was
And
a good idea, Bree. I like that.
And then I added the rest of the increase to in-state travel, because we have an old vehicle that we use in town, but it's not safe to drive on the highways. So we do have to take our personal vehicles, and a lot of the trainings are Central Mass, Eastern Mass. So we actually do typically go negative in that line. So I wanted to make sure that we kind of focused there.
Okay.
Aren't most trainings that are offered right now also virtual?
Some
Like, are you seeing a lot of in-person trainings start up again?
This year going to the Cape pretty much depleted our to the MHOA conference. That pretty much depleted because both Brian and I went. And then yeah, they're starting to move to in-person. DPH has an in-person training in April in Holyoke, which is, you know, I wouldn't even for that. But yeah, they're moving towards some in-person stuff. So any questions on that?
Mhm.
One question that the mayor brought up was the medical supply line is pretty small, but we utilize CARES FEMA. We have a lot of PPE. So we're gonna see where the 200 brings us this fiscal year. And if we find that, you know, there's this, you know, we need PPE again or something, you know, we can revisit it. But she did mention that as they might question that. So I just wanted to mention that.
And the state is starting with the FEP planning with so much free. I don't know what you're getting from Lauren, but the FEP monies are paying for a lot of that, and they're getting it for free from the CDC. So we should utilize as much of that as we possibly can.
Yeah, I don't see a reason that we'll need to buy PPE for a while. I mean, we had a meeting, WMPHA today, and HMCC came and presented, and they have PPE.
We should not use acronyms.
Sorry, Western Mass Public Health Association, which is the monthly meeting that I attend. It's an association I'm on. And then HMCC is Health and Medical, what's the CC, Amy? Health and Medical something. They're out of Franklin County.
I'm gonna look it up.
But they're federally funded. I think they're state funded, and they work to kind of connect EMS, hospitals, public health, and emergency planning. They were created post 9/11, I believe.
Health and Medical Coordinating Coalitions.
Yeah. Thank you. People use acronyms around me all the time and I get lost. So, so this is the kind of the salary page. Anything in yellow is current for this year, or what we're asking for FY23. So everything's pretty standard. You'll see the steps. You'll just see kind of the grade, and then every January we get a step. January and July. So you'll see 5, 6. For the number of employees right here, we base an FTE, full-time employee, off of 40 hours a week. So majority of us are 34 hours a week. So to calculate number of employees, FTE employees, you would do 34 divided by 40, which is 0.85. I'm 0.875 because I'm 35 hours. And
Marie, are the only adjustments the step increases?
what do you mean?
So the increases, is there any additional increases to salary besides what is already required by unions or the step in grade?
So as of July 1, there was a 3% COLA. So besides our steps, our entire scale, which is shown here, was increased by 3%. But other than that, nobody's jumping grades or,
Okay,
and I'll talk in a second about.
just the 3% merit and then, right, okay.
This column right here, I added, our finance director asked me to add it because it is confusing seeing these two numbers. The public health nurse and health inspector were almost about halfly, if that's a word, funded by CARES FEMA. So it's important, you see 53,000 for the public health nurse, but 26 of that was actually funded by CARES FEMA. CARES ended in December and FEMA is continuing till July 1, but after July 1, these salaries are going to just be general fund. And the reason you see the public health nurse decrease is because with the significant decreasing of contact tracing and COVID related kind of work, I mean, it's still there. She's definitely still doing contact tracing and making phone calls, but it's decreased significantly. We both kind of had a discussion about that position coming down to 25 hours. There's a lot of education and public outreach that we need to do that we've never had the ability to do. And, COVID clinics are not over. And besides COVID, there's other clinics that we can do, flu clinics. And the other reason I felt comfortable putting that to 25 hours is because we signed on with a grant with Northampton, which is a public health excellence grant. And it's that will kind of help, I guess, bolster our public health nursing throughout the region.
Okay.
And then the health inspector position is full-time. And like Amy said, the state is moving towards having, really buttoning up the standards. And with our health inspector position, we're finally at a place where we're probably going to be able to meet our mandatory 2 inspections a year for food establishments and pools and body art. So we're in a really great place staff wise. And then the community social worker is funded by ARPA. So that's why you're not going to see it in this column. And then just like you saw these salaries on the last page, that is funded by the Drug-Free Communities Grant. So are there any questions?
Oops,
Sorry.
that's all right. I can't think of any right now.
I think it's a great budget. I mean, it seems pretty straightforward. I think you've provided the mayor everything that she's looking for. And I don't have any questions. You don't need us to vote on this, right? It's just more for in case we had any objections to something.
Yeah, I don't think technically you have to, but I obviously like to get the board's blessing and make sure that you guys are aware of everything that we're going to be presenting to city council. I believe it goes to city council April 6th, which means it has to be into the city clerk the week before. So that's why we kind of have this meeting today.
Okay, so you'd like us to vote?
I don't
Sure.
have any questions. Looks good.
All right.
This is my first budget meeting, so.
This one was pretty easy compared to some
I
other.
can tell it looks good.
I know the mayor was surprised at our budget this year. She's like, she said it nicely. She's like, I didn't think it was going to be this organized. And I'm like, what is that supposed to mean? But it's just, it's been difficult with all these different funding options throughout the pandemic. I have so many spreadsheets and so many, so it will hopefully be straightforward this year.
She might start asking you to work on the city's budget.
I can't even imagine.
Run as fast as possible.
Yeah.
So if you'd like a vote, I just have one more minute left that I'm able to stay on the meeting because it was an early one. If you'd like a vote, I'm happy to make a motion to accept Bree's proposed budget as presented.
I'll second that.
All in favor?
Amy, yes.
Beth, yes.
Maggie, yes.
Thanks. Amy, before you go, our next meeting is April 5th, 5:30, same time. Today was a little bit different, but does that work for everybody still?
Yeah, I since you brought it up, I'm just gonna mention that Tuesday might not be the best night for me. However, I'm starting a new job as of April 11th. So it's kind of hard for me right now to know what my schedule is going to look like going forward.
Okay.
So the idea of having a monthly set meeting may have to temporarily change just because I don't know exactly what that's going to look like. It's a completely different job. So
Okay, we'll just
putting that out there.
Yeah, let us know, Beth. And also, we're probably going to have to do in-person meetings starting this summer.
Okay.
So we wanted to let the two of you know because of childcare and scheduling issues and so on. So when you get that schedule, Beth and Amy, I don't know what your schedule is these days. We'll just have to figure that out when we can. But just a heads up to start thinking about it.
All right.
Sounds
I'm sorry, I
good.
do have to say goodbye now. Goodbye, everybody.
Bye, Amy.
Well, we have to is there anything else? We can make a motion to end the
I
meeting
have
then.
nothing else, so I'll make a motion to end the Board of Health meeting at 5:26 p.m. on 3/15/2022.
I second that. And also, all in favor, Maggie, yes.
Beth, yes.
And Jackie, will you just note that Amy left? Had
Yes.
to leave before we close the meeting.
Yep.
Okay,
Very good.
good
Thank you.
job, Bree. Nice.
Good job.
Thanks.
This government meeting is brought to you by Eastworks and our local cable subscribers.